Ashley, can we get a sound check?
We sure can. Are you able to hear me?
Wonderful. So is it showing recording?
Recording has started.
Yes.
Right.
Ready? Yeah.
So,
We are ready. Okay. Good morning. I'd like to call to order the Board of Health meeting. My name is Ralph Pearson, the Vice Chairman. I wanted to say thank you for Rachel for being the chairman for so many times, so many months to come. So it's all new today. So thanks for everybody for coming. Next would be the roll call. Lois is here, right? Lois, Jeff? Yep. Rachel's here?
yes.
And Ralph's here. We have three people that are not here, right? NK, the new one, that's coming up. So, hey, exciting to have you here.
Thank you.
Okay, I just want to hear ask for approval for the minutes.
So moved.
Second.
I'm sorry, who's that?
Okay, Jeff,
Thank you.
you were here, but yeah, move it forward. All approved? Okay.
Aye.
Aye. Pros? Nope. Okay, good. Any public comments? From anybody in the room here want to make any public comments? There you go. Come on, do you want to come up here or would you like to stay there?
If I may stay here and I'll make sure I speak loudly and clearly. I'm speaking regarding two of the ordinances or amendments that are coming before you today. And one of the reasons that I am here personally and have my name on this resolution is because when I ran and gathered signatures, there were several things that people asked that I please do or look into. And this is one of them. This includes people not only in my district, but I have had several from outside of my district and in this county ask to please take action. I did learn in all of this that Wisconsin is a very unique state because of pecuniary. I apologize. I may be pronouncing. I have not heard the word or several of these words. Just read them. Pecuniary rights of the people to challenge how tax dollars are spent, and that is some of the legal positions that were taken in lawsuits brought forward. And I read very much and learned about stare decisis. I learned about 323.10. I learned about citizen involvement and separation of powers. I absolutely want to clearly state, and please don't misrepresent, this is not an indictment of the previous board, nor any member or staff of Winnebago County, either on the health board or in this building. Please do not misunderstand that. What this is the progression of the ordinance based on case law that does not take away but solidifies the case law through the county, but more specifically the state or throughout the country, but more specifically throughout the state of Wisconsin. And we're just moving Winnebago forward in order with that. This helps clarify an order versus law versus advisory versus the county's course of action. As we all know, science has evolved and there are now lawsuits currently filed against the FDA, CDC, Pfizer, and other manufacturing companies, but that doesn't really apply here. Only that I'm only mentioning because there are dozens of lawsuits throughout the country. Specifically to Wisconsin regarding executive orders that were issued. One case I'm going to mention is Legislature v. Palm. Palm, as you probably know, I'm sure Doug is very well aware, was the Wisconsin Department of Health and Human Services that issued orders in conjunction with the governor and advisory directions to the county. This lawsuit was fast-tracked to the Wisconsin Supreme Court, where it received a 4-3 decision. It is most interesting to note that the majority and the dissent opinions, and I would absolutely encourage everyone to read both. In the dissent opinion, something that I thought was interesting is while they weren't in agreement with the majority, they did say that they would issue a stay regarding these orders. And I think that's very interesting to point out. What was at issue is takeaways from this lawsuit regarding clarification of structural delegation. The court specifically called out State Chapter 252. It's stated under 252.03 and then 3, 4, and 6 that the powers of those in Chapter 227 state that rulemaking power can only be exercised through adequate procedural safeguards, and rulemaking must involve public participation through a legislative process. Most notable to point out is not only did this dissent clearly say that stay would be issued, but the Evers administration could have very easily appealed or asked for action in the legislature, and they did not. In Favik v. Evers, the case also called into question the response. Specifically named was Executive Order 105. This was about multiple emergencies based on the same or similar conditions that were declared invalid or unlawful. I would absolutely encourage everyone to read some narrative from Von Briesen. To be fair, it's 60 pages, and I'm not going to recap that here. There was also a subsequent from the Von Briesen law firm on this on October 14th of 2020. That one's only 6 pages that you might be interested in. You can find those links through the WCA website. Again, this decision was a 4-3 decision, and the justices referred to a lot of case law through the Supreme Court of the United States, as well as the previous rulings in the state of Wisconsin. There is James V. Heinrich. Heinrich was the public health officer. That specifically went off of Andrea Palm's orders and the executive orders. And it was determined that it was detrimental to school children. And we have all seen the data of what's happened to children regarding drug use, depression, the lack of speech development in some of the younger people, or the younger students. And the court agreed that stating the schools are not the same as considered public gatherings. Thought that was a very interesting part of the ruling. There are other lawsuits. Something that people very often go back to is what is known as the Jacobson ruling, which I believe was the early 1900s. And the court determined the Jacobson ruling does not apply in this case. There's also Tavern League of Wisconsin v. Palm. That was also a 4-3 decision that talks about the ability to limit gatherings. I could go on for hours. I have easily combed through over 3,000 pages and watched 100 hours on YouTube, Wisconsin Eye, and people talking on YouTube about all of these cases. I understand for you and for the county board, this is not going to be an easy decision. Again, I want to clearly state this does not take away or remove authority or advisories from the health department in Winnebago County. What it does is, going back to the ruling of Legislature v. Palm, is that it asks the board to come back and reconsider it more often. Again, do not take this as an indictment of our health department. This is not an indictment of the county executive or anyone in this building. This is only a progression. It is not a repealing of 1108. It is amending 1108 to keep up with case law involving public involvement. Thank you very much for your time.
Thank you. And being new, I forgot to say your name. I have to have your name and your address,
My
please.
name is Conley Hanson. I am Supervisor District 26 and a co-sponsor of the 2 resolutions that are coming before you today.
Appreciate that. And the only other thing that we probably should have is that I'm going to try to keep it to 4 to 5 minutes.
Did I go longer?
No, you're fine. I wasn't timing. I never beat her, but I just wanted to make sure you know that. And if there's time, we can go a little longer because it's a very interesting topic that we should talk about. So thank you. Is there anybody else in the room that'd like to speak? Is there anyone else? Is there anyone on Zoom that'd like to speak? Is there anyone else on Zoom that'd like to speak? Last chime, is there anyone else on Zoom that'd like to speak?
We might need to give them a minute.
Oh,
This is a new platform
Gotcha.
and they may not know how to raise their hand or.
We're just on a new system, so I just wanted to check, make sure we didn't miss anybody. that
You have an option to click raise your hand
Okay.
on the top of the screen.
Okay.
Somebody unmuted themselves. If you'd like to speak, you can go ahead. Okay.
We need to ask if she wants to speak.
JJBdoc@charter.net. Would you like to say something during public comment?
I guess. It's also fair. All right,
No, maybe.
stay. All right, now, more public, so now we're on to business. And the first point of business is to welcome Kay Haran, Supervisor Haran, to our board, so appreciate you, glad to have you.
And I would like to say thank you, Doug, for yesterday. It was really informative. I went home and I went, oh, thank goodness I'm home. It was a full day.
Good, well, we're glad to have you, okay?
Thank you all.
Now, our next point is to elect a new Board of Health. Our chairman, I should say, thanks to Rachel, she's going on to some other stuff, but she'll still be staying on helping us, so do we have any nominations? For chairman,
Ralph Harrison?
I'll second.
anyone else? All in favor? Aye. Yes, thank you, appreciate it. I hope I can do half as good as you did, so how's that, okay? Well, next thing I think we have to do, because I was the vice chairman, so we have to elect a vice chairman. And Josh had told me, he sent me a note that he'd like to be vice chairman, or like to be nominated. And I think you can nominate him if he's not here, but Josh wanted to be vice chairman, so that's just one. I want to make Josh feel.
So I have a question. That's not on the agenda.
So. It automatically it's on because of change of office.
If you look, it does say elect a new Board of Health chairperson. This is a vice chairperson. So I think that's fine. Okay, just think it's fine. It's there. Right, second the nomination for Josh.
Second for Josh. All in favor? Aye. Opposed? All right, welcome, Josh. Okay, next is C, an ordinance amendment, 11084, definitions for individual and general orders. What, who's gonna, which one of the three want to come up? Okay.
Probably.
Us up here.
I don't get a spot up there.
We can pick a spot for you.
Move in.
Could you just state your name?
Sure. Brian Defferting, Supervisor for District 6 inside the city of Neenah. And thank you everyone for considering this ordinance proposal that's in front of you today for the Board of Health. The history on this, I mean, I don't really need to, I don't think I really need to go through the history on this. I think a lot of people know about the history on this. There was a lot of consternation within Winnebago County in regards to this particular ordinance that was passed in 2020. And there still is a lot of niggling concern from our constituents, our residents in Winnebago County. And specifically in regards to individual orders. If you look at the current verbiage of it, it does state that any health order under this ordinance applicable to a specific person, a group of persons, or gathering spot. And a lot of people had a lot of the concerns that we had from our constituents, from especially from those that I speak with in my neighborhood. They were very concerned that these individual orders could possibly apply to any type of public gathering. And that could apply to, it could be like a public protest, maybe at the sundial, or perhaps gathering for mass for religious reasons for church. And so this, upon research and lots of research too, and I want to thank Corporation Counsel for a lot of her education on this, because I had to go through the rabbit hole too of legalese. I'm not a lawyer myself, although my dad is one. And so upon looking at what it was for individual orders and what per previous rulings of the Wisconsin State Supreme Court, because there's been numerous rulings on this over the last couple of years, that there is still the public health officer does have the power to quarantine for certain types of communicable diseases, whether they do name tuberculosis in the state statutes as one example. Hepatitis B, I believe, is another example. And so we wanted to make sure that we're not impinging upon the people's right to free assembly. That's the key thing here, is that obviously we have concern for public health, but we also don't want to impinge people's right to free assembly. And so this particular ordinance takes that language, group of persons or gathering spot, and just moves it to general order. Because that's where I feel it belongs, and that's where my constituents feel that it belongs. So that way, if that, just in case, that this is kind of more like future-proofing ourselves, we are constantly looking at the language, or constantly amending the language and making sure that that we're still protecting our civil liberties. And so that's where this ordinance comes into play, is just taking that language and moving it to the general orders part of it. So that this then follows state statutes in regards to individual orders, whether that be quarantine of some sort. And so it just seems to be more in line with it, be congruent with it. So that's the heart of this, is that the ethos behind this is to make sure that we're not impinging upon people's civil liberties.
We talk about the first one, or you want to talk both of them together, or should we do?
If you.
Are you here anyway, and then we can discuss it?
Sure, I mean, it's up to you, whatever the board would prefer, we could talk about the other one as well.
Want to talk both of them again?
I think,
Individually. Oh, I'm sorry, behind, sorry.
I was just thinking it might be clearer if you do take one up individually.
Okay, I agree. Okay, agreed? Okay, cool. All right, so any discussion here? Anybody have any questions? Thoughts?
well, I want to see.
Okay.
I would just say if we're keeping current with the current law, this makes sense to me.
I have a question, like, how does this change anything? Like, if we had a breakout of tuberculosis, you can still, right, like, it doesn't really change. What's the difference between an individual order and general order? Well, if Doug gave it.
Don't answer that. So tuberculosis may not be the best example here because the communicable disease statute specifically addresses tuberculosis separate from other communicable diseases. And so an example, so I could just use one that's going on right now, measles, right? So we've had cases of measles in Wisconsin and Illinois. Measles is a highly contagious disease. It's vaccine preventable. 9 out of 10 people that aren't vaccinated are likely to become infected. And a quarter of those people that are infected are likely to end up in a hospital. And so there's an extremely intensive response going on down in the southeast part of the state right now in order to try to limit the spread of measles in our population. And so in a case where, we have identified someone with a disease that is likely to spread and or impact others, we are going to work with that individual to find the source of that disease, find out who they've been in contact with, and try to limit the spread of that disease. Typically, that process goes fairly smoothly. Most people don't want to spread the disease, and are voluntarily compliant. On occasion, someone may not have regard for that. And in order to protect the community or the public, we would have to issue an order to isolate someone that's been exposed to a disease, or to quarantine someone who's been exposed to a disease, or isolate someone who actually has disease and can impact others. That is really the most typical situation in a single case. Now, let's say, in terms of group of persons or gathering spot, in the case of, say, measles, we might have a group of persons that have been exposed to measles. And that group of persons, some of those individuals may develop disease and then spread it to others. In that case, we would be looking for, voluntary isolation for the period of, that disease that may develop and be communicable to others, so as not to allow spread. And so that's a case where, let's say someone was in a meeting, one of us, for instance, is in a meeting, we have measles, or we aren't exhibiting symptoms yet, but we're contagious to others. And there's unvaccinated people, we're gonna let everyone know that they've been exposed to measles and ask them to quarantine themselves. If they're not willing to quarantine themselves, then we may issue an order if that's most appropriate in order to protect the public. And so that's, that would be a single disease instance for a group of persons. A gathering spot, may come into effect when, a place or a location is the source of disease. And an example of that isn't super uncommon is a disease caused from, a bacteria like Legionella, where, a cooling tower, is spreading bacteria that's infecting people that work there, or metalworking fluids has Legionella bacteria in it, it's infecting workers at a plant. That's a place where, in order to protect the workers that are there, we would ask for voluntary compliance, of course. But if that voluntary compliance didn't occur and we want to prevent that disease from, occurring in a large group of workers or at a place where that bacteria is harbored, then we would potentially issue an order to, to correct that condition, to cease operation, to keep people away, whatever is unique to that particular situation. And so if we're not able to issue an order, if necessary, and again, it's pretty rare that we actually have to do that, then we are not able to react and work to prevent disease in a timely manner. Because the second resolution, of course, is about, it's only advisory unless the board approves, and there's no provision in that for the board to even take it up. And so if we needed to issue an order to prevent disease at a location, we wouldn't have the authority to do that.
But this one doesn't stop you from, like the one with the first one, that doesn't stop you.
This changes the definition and it makes it a group of persons or a gathering spot, a general order. And the general order is handled differently than an individual order is the point.
Okay,
And so in code, an individual order is considered to be a person, group of persons, or gathering spot. And that's really a category unto itself versus a general order. So we would be redefining that as kind of currently laid out and interpreted, in state code. Sorry, Rose.
Yeah, I'm wondering about the difference between the individual and the general order in terms of how effective it allows the order to be and how effective it is at suppressing that disease. Am I saying something wrong? Oh, you kept raising your hand?
Do you want, is it okay if she gets in? You, Marianne, do you want to make a comment about the legal
Sure,
part?
just tell you the difference between a general order and an individual order. And let me just sort of go back to sort of give everybody an overview, although I'm sure a lot of you know what has occurred over the last few years. But basically, after the Supreme Court decision in Legislature versus Palm, Wisconsin Counties Association created a task force, okay, to address the questions surrounding implementation and enforcement of local health officers' orders under WSStat 252, right? And the ordinance that we have on the book was based on review of all of those task force meetings that were prompted by the Wisconsin Counties Association. The bottom line is, in terms of local health officer orders, there are individual orders and there are general orders. So the orders fall into two categories. In terms of individual orders, you cannot modify the mechanism. The local health officer has independent authority to enforce state law. And that is under Administrative Code 14506. Basically, the local health officer can do numerous things. They can order a participation in an education program. As Doug said, I know the emphasis is to start with voluntary compliance, and then it's a step procedure. They can order participation in a treatment program, that type of thing. The other option, again, this is just individual orders, is they can petition the court if this person is ignoring the order, and say, listen, this person is not following the administrative code. General orders are different. As Supervisor Deputy, Supervisor Hanson, Supervisor Sloan, no. The enforcement mechanism for general orders is our ordinance, 1108. So if 1108 is vacated, there is no enforcement mechanism for general orders. Now, the Supervisor Hanson referenced in his overview, there's legislature become, but there was also another Supreme Court case, and that is Becker versus Dane County. And that came in after legislature versus common. And the question was whether local health officers could lawfully issue public health orders. This was again involving Dane County. And it was a suit that arose from a challenge to a local health officer issuing a public health order to prevent and suppress a communicable disease. So the answer in that case was that WSTAT 25203 grants local health officers authority to issue orders, and that the local health officer authority to issue public health orders under WSTAT 252 does not run afoul of the constitutional separation of powers. But what this ordinance amendment to the ordinance, and as Supervisor Defferding indicated, what he and Supervisor Hanson and Supervisor Flo are suggesting is not to eliminate this. What they are doing is to basically clarify some language in the definition section. So essentially, they're clarifying the language in individual order and general order. And then even though I know we're not addressing it, the next portion would be basically putting certain limitations on general orders. But that's what my understanding is of what the supervisor is trying to do. Does that answer your question? To just give you an idea. So individual orders, there is an enforcement mechanism, and it is through the administrative code. For general orders, the enforcement mechanism is through 1108. And this amendment, and obviously the supervisors can correct me if I'm misstating anything, that they are proposing is to try to clarify the language under the definitions. I make no policy decision regarding this. I just tell them whether it's legal or not. And my opinion is that it was legal in terms of what they were trying to do for the definition section.
Then we did a check with WCA, right? They suggested that it was okay, let's say, or this is what their thoughts are.
Well, yeah, originally, I mean, the original
Yeah.
ordinance was based on Wisconsin Counties Association Task Force, 60 some odd page, compendium that Supervisor Defferding referenced. And then actually, when we did speak, when you came to me initially, Supervisor Defferding, and we were looking at this, I spoke with counsel from Wisconsin Counties Association to get their opinion as well.
I understand that apparently it's legal to do that, but does it make any sense in terms of suppressing disease in our communities?
That's not my.
Yeah, that's my question that I'm bringing up. I don't understand how this is going to further the suppression of communicable disease. When you put that type of order into or that type of action into a general order where we cannot really control a person's movements if they have a disease that is threatening the entire community. And we make that a general order and hope for the best. You know, what sense does that really make? I mean, do we really want to control disease in our community? And have it overseen by people who are trained and know what they're doing and understand how diseases work and how they spread? Or do we want to make that a general order and say, well, you know, here's what could happen. I'm giving you the information. I really hope you do the right thing. And leave it at that. I just can't wrap my head around that. Do we really want to be healthier or not?
That's not why I understand this, you know, that it's just a changing of definitions, correct? To go to have
Right,
individuals
and
under
if we
individuals
change-
and group under
If we
the.
change the
general.
definition and make it a general order, then it's approached differently. Am I seeing this wrong, Doug, or am I just talking through my head, or is it making sense? Maybe you can explain it in a different way.
Yeah, an individual order can be issued as needed. A general order is only advisory until the county board says it's an order. And so, you know, that could take, you know, it could take days or weeks to occur. In the meantime, you know, essentially you have a voluntary, you know, compliance or not with that, with
Right.
no, you know, there's no enforcement mechanism in place.
And listening to this as a layperson, you would think, well, there's no difference here. But from someone who has worked in this field for 30 years, time is important. It's of the essence. You know, hindsight is 20/20. When you say, boy, I wish you could have, you know, tamped that one down sooner, we would have had 200 fewer sick people, you know, with whatever it is, bacterial meningitis or whatever it may be. Time is of essence, and you need to be able to act soon. I mean, you can't just wait till the next county board meeting and hope you can convince enough people who really don't understand how these things work to vote the right way. I just.
Oh, yeah. And you know, your concern is 100% valid. I mean, I agree with you. In regards to individual orders and specifically like, let's go with Director Guerin's example in regards to measles. And let's say there are a group of people that are exposed or potentially exposed, that may be exposed. I mean, if this ordinance were to pass, that just simply means that the director can provide, whether it be 5 individual orders, 10 individual orders, or 20 individual orders for those people that are potentially exposed. Because I mean, they will have to get to know their names anyways. They're gonna have to get to know their identities. So you can still have that ability, have that enforcement mechanism there. You would just simply do multiple individual orders. And in regards to a gathering spot, we have to keep in mind that we have these ordinances are, you know, to future-proof Winnebago County. I mean, you know, Director Guerin is not going to be the director forever. You know, we're going to have a different director 100 years from now, 200 years from now. And if it says gathering spot, we have to keep in mind that gathering spot could mean anything. It doesn't necessarily mean like a place that is necessarily, you know, if the place does actually have a lot of infection or bacteria growth or viruses, viral risk, I get it. But I mean, again, we have to keep in mind what exactly happened during the last pandemic. We did have a lot of protests that were going on at that time that had nothing to do with COVID. And we have to realize that we have to make sure that the law does not prevent exploitation of power for those that, specifically for those that are not elected into that position. So we have to make sure that the language is, you know, curtailed specifically for something like that. But if you just simply say gathering spot, you are covering everything. And that could mean any gathering spot, and that can be exploited. So I understand the concern and I get it. But, you know, at that point, we have to take a look at what gathering spot means and exactly what, you know, what it should specifically apply for, so that the next director that comes in could not potentially exploit this, this power that has been given to them by the state.
Thank you. Just Supervisor Hanson, because he's part of the resolution. You're welcome to comment.
Thank you. I understand what the member is saying, and I absolutely thank you for saying it, and to Director here and to Mary Ann. This first one that we're talking about is really just clarifying language. The health director, as Supervisor Duffy said, can issue orders. This does not prevent him from issuing individual orders. This does not prevent him from going to court to enforce those orders. This is not repealing 1108. This first one is just simply clarifying language.
Thank you. And you're part of the.
Yeah, let me also add, you look at what a department head is tasked with in state statute, they have a toolbox that is in the industry code or in state law to achieve what they are set out to do. And when we looked at this, and when Supervisor Bethany took the lead on this, the idea was not to take away tools from the toolbox, but further to refine them and make sure that there's proper public oversight. So the idea wasn't to take away authority, but to refine it.
There's questions or
Just a question. Individual order, Mary Ann. How do you interpret individual order being defined in the state code?
On
And,
this,
and are we,
there's a request for you to talk a little louder.
talk about it,
Yes, please.
how is individual order defined in state code in a way that at a local level, we're able to redefine that? In other words, state code puts in place powers for local health departments to issue individual orders under the context of an individual order being a person, group of persons, or gathering spot. Can we, as a local government, actually redefine that to effectively reduce that authority that's put into state statute, I guess is the question. I want to make sure first and foremost that we're not running afoul. And that we subject ourselves to some contest if this passes, that it's legal or not.
And I'm just quickly looking at the statute to see if there's an actual definition, and there isn't.
Right.
Under the section of 252, under definitions, they don't address individual or general orders.
Right.
We were able to cobble that together based on basically the Von Reason and the task force looking at how do you define individual orders versus how do you define general orders. Now, let me see under definitions guidance, because I believe they were addressed here.
And I'm asking that because I have really limited time to react to this, and I actually sent you a reference yesterday, that a reference in a document yesterday that categorizes the orders this way. And so you may not have had a chance to see it. I didn't have a chance to really work on this because I just wasn't aware of it until we put out the Board of Health agenda.
There's
And
nothing in my email at 5 o'clock last night. Maybe.
it was later.
Okay.
Yeah, and so I mean, there is another document that made me question whether or not is what we're proposing actually allowable. So, I mean, we could definitely, as a county, be more restrictive in certain senses in the application of law, or be more restrictive, but can we actually reduce the authority that's in place and in essence, taking away the authority that's already put forth by the state?
I have not seen the document that you sent after 5 o'clock last night, but I can tell you that under the general order premise that we have right now, as Supervisor Jeffrey indicated, if there are individual people who make up the populace, and there are certain people who are violating, there is no question you can issue individual orders. Now, I understand under the general order, and we haven't taken this up yet, the suggested amendments are basically saying that any order is advisory until, and this is the change, either revised or reaffirmed by, and the changes at least 2/3 of the entire county board membership. And then there's time frame. That's the next one we're going to take up. I clearly, as we talked about, you have authority under the individual order, no question.
I'm only asking about the definition. Can we change a definition that,
We're,
if not completely defined, it's at least interpreted as what an individual order is in the guidance? That's my only question.
and what I would just say is I am hesitant to say anything when I haven't read what you forwarded to me. But based on everything that I'm seeing, I would think that if there is a general order and there's someone not in that group who is not following it, then you have every right to, again, it might be a little onerous, issue specific orders, because there is the due process, right? You can go to court. So then you make your case, and you have to show that, yeah, in fact, there is a disease and there is an issue. And then the person who is being targeted by an order has every right to go to court and get his or her due process.
So understood. I mean, persons, group of persons. I mean, we could be talking, we could be talking an indoor event, we could be talking a plane ride, we could be talking, a group of persons that are probably somewhat unrelated and, happen to be together and are exposed to disease. Yes, there is, there's potential ways through that, that are very time consuming. The gathering spot piece, I guess I just want to draw attention back to that. A location can be a source of disease. And if we're not able to address that source of disease, because, it might be a business that's, trying to stay in operation, but their metalworking fluids are contaminated and they're infecting the employees. It might be a natural occurring source in the environment, that we know, is, we've had, blastomycosis outbreaks, fungal, outbreaks that have occurred. Where, we want to do everything we can to try to limit, the exposure to those things, because they are location based, and that's actually one of the more easy things to control, and reduce illness by. If we don't consider that an individual order, then, and it's a general order, there really isn't a way to respond to that rapidly, to eliminate that source. So I just want to make sure that we understand what that is. Clearly, there's no, this is about controlling communicable disease, not controlling assembly for people. And we've, I don't know if we've ever issued or had to issue an order yet. But it's certainly a power and authority that's in place and has been in place for many decades, that without it in place, we may certainly have situations where we wouldn't have been able to control disease. And, we rely on voluntary compliance almost all the time. If there's a law, people follow it. If there isn't a law, there isn't a whole lot of compelling, need to follow it. And any order without an enforcement mechanism isn't an order. It's just an advisory. So I just would want you to consider that. I would be concerned about the definition and whether we can change it, even though it's not specifically defined in code. And it just, to observe it. This is a public protection that's in place in case it's needed. And fortunately, we don't need it much. We have lots of voluntary compliance. But if we do need to act quickly, at a spot or for a group of persons, this will definitely be limiting in our ability to respond.
Okay, appreciate that. Oh, one second, Marion, you wanted some back, I think he said.
I'm just quickly trying to look at again that 60-page guide that was issued by Von Briesen. And they talked about, the guidance was divided into 4 categories: investigation and reporting, that's Doug's authority; isolation or quarantine orders that apply to a specific individual, again, that's Doug's authority. And they said orders that apply to a specific person, group of persons, or gathering spot, including a business, that are deemed necessary to immediately control potential spread of communicable disease, sometimes referred to as outbreak orders. And then the 4th one was general orders. So if you go to, and again, I'm just trying to quickly look at this, the 3rd, the quote, outbreak order, right, which is orders that apply to a specific person, group of persons, or gathering spot. It talks about local health officers have authority to issue orders applicable to a specific person, group of persons, or gathering spot that are deemed reasonable and necessary to immediately control the spread or potential spread of a communicable disease. These orders are sometimes referred to as orders dealing with an outbreak situation. And while somewhat different than an isolation or quarantine order specific to an individual, are treated substantially similar to an isolation or quarantine order. So what does that mean? That means that they're putting the outbreak order and the isolation order and the quarantine order separately from the general order. And then if they're talking about isolation and quarantine or outbreak orders, again, they talk about not only a specific person, but a group of persons or gathering spot. But and I'm just quickly looking at this, and again, I have not read what Doug sent me.
Want to say something?
Another thought that I had as I initially read this is, as you could probably tell, I'm not in favor of changing this definition and separating specific person away from group of persons or gathering spot. That belongs together, because when you talk about the group of persons or a gathering spot, that relates directly back to that specific person. It's the group of persons that would be around that specific person, and you can't separate that when you're talking about communicable disease and the way disease spreads. But I have a question for you. How do you see this change that's being proposed? How do you see that furthering the cause of limiting disease? How do you see that this is going to make it more possible to stop disease from spreading? How do you see this? What's the advantage of doing this?
Well, I think we have to keep in mind that when it comes to preventing the spread of disease, what's the best way to prevent this the spread of disease?
Right.
I mean, is it do we, my personal opinion is, what's the question here? Is do we corral people like cattle, or do we provide them with the tools necessary to prevent them from spreading disease? And do we give them the education that they need to prevent the spread of disease? Do we teach consideration and respect among all of our people within the community to prevent the spread of disease? And can we actually work together as a community to better public health? All of these things, in my personal opinion, does not have to be done through law. It can actually be done through just simply working within the community and through voluntary commitment and just, being a good person. And I think that is probably the number one most effective way to prevent disease.
I totally agree with you. Real, I do. But the things that you're describing are things that need to be done, throughout the community over a period of time. It takes a lot of education. We could go into a whole diatribe about how measles is it's transmitted from person to person, how viruses act, how, actually on a cellular level, how these things happen. And, like I said, everything you said is true. A mass education campaign is more than appropriate for an entire community. And it takes a lot of time to really get people to understand, why we ask them to do certain things or behave in certain ways. But what I'm still asking you is if Doug is aware of someone with a case of measles who is now going to be, say it's a small child, he is aware that that family is going to take that small child and go to a family gathering, say, I don't know, a wedding shower or something. Are we going to get a hold of all of these people and start to educate them? And they're going to have this meeting this afternoon. Are we going to get a hold of them all? We're going to do our education. We're going to try to explain to them what took years in college for us to understand how this works. And you can't see it happening, but if you understand how it works, you know it's happening. And we're going to have these lay people understand. And they're going to not meet because now they're educated. Or are we going to have this as something that Doug has the ability to say, no, you can't. We're going to have 30 cases of measles if you guys, you can't do that. He's got to be able to stop it now. I mean, it can be followed up with all kinds of education, and that I agree with you 100%. Education is needed and good communication. But if you take group of persons and gathering spot and separate that away from specific person, again, you're going to be sorry all day long. It is not a good idea.
Look, if I could just add on to that, orders are a last resort. Absolute last resort. And Mary Ann already outlined, there's a whole list of considerations that we go through. And there's also, of course, just the situation that's unfolding in front of you. What's reasonable and necessary is language that's repeated throughout the statute code. An order only comes in when there really isn't another option. And without, and we're always looking for the least restrictive way to prevent that disease from being transmitted. So, I mean, that is just baked into how we respond. And so we always approach this from how do we minimally impact a person's, rights and freedoms in preventing disease to protect a community. So I'm just making that difference.
If I may, Mr. Chair.
Just one more, I'm gonna say something a little bit, but not yet. Okay, I just want to make sure, but I don't want to stretch it all on. I don't want to be a battle against each other. I want it to be, when we're learning, this is the discussion, so we know all sides and we can have our opinion, okay? Some is not prepared yet, some are not, whatever, but this has been going on for a long time. And I'll say my part, but I see a couple of hands and I don't want, go ahead first. You had something to say. I'll say mine after I just want you to get it.
All right. No, thank you, Mr. Chair. I appreciate the chance to speak. And I deeply respect everyone's responses here on this and their concerns. Like I said, they are very legit concerns and for the most part, I agree with you. When it comes to law, we should never judge the law by its intentions. We should always judge it by its results. And oftentimes we have seen over the last 100, 200 years that sometimes law can be exploited to something of what it's otherwise intended to be. And I fully trust you, Director Guerin, that you will be judicious with your authority and that you will not, exploit it beyond what is invested in you as a public health officer. But, and I have to belabor the point, but we have to future-proof our county to make sure that our future public health director does not potentially exploit these powers. And I get it. I get it that sometimes people, they do gather and there's that possibility of spreading disease. There's always going to be that possibility, no matter what. But I also feel that authority should be derived from the consent of the governed, not necessarily through threat of force. And if somebody were to just simply put an individual order and bypass the county and bypass any public discussion on this matter, there's still that, there is no, consent of the governed there. And we have to have those checks and balances. And yes, even when it comes to times in times of a pandemic, probably especially during the time of a pandemic, because we cannot have these powers be potentially exploited and ballooned beyond what it's intended to be. Now, I get it that this is actually more force spring to prevent the spread of disease. I get that, and you're right, but at the same time, we have to have that constant discussion and constant check and balance of what to make sure that we're not impinging upon civil liberties. So I know I'm repeating myself, and so I apologize, but that's what I have to say.
Supervisor Hanson, he had to ask her. Did you want to say something?
Just, the supervisor definitely brought up, most of what I was going to say. To the example, if Director Yearden is aware of some of the cases, he absolutely can immediately issue the individual order. This is not a repeal of 1108, and this first one is just clarifying definitions. But would like to ask, now that it's been broached, just off the top of your head, and I no names, no specifics at all, how many general or individual orders did you do since this started? Because I don't think you've used it.
So when you say this started, are we talking about?
1108, when 1108 was enacted.
Okay, so essentially since during COVID, since 1108's been acted, we have never issued a general order. And on individual orders, I'd have to check with the team. Specifically for communicable disease, I don't believe we've issued any. For environmental health, it's possible. That's especially as it relates, as it would relate to a location or spot. And I guess, the history of, the history of 252, which was put into place in the early 80s under Republican Governor Lee Dreyfus, was a bipartisan, overwhelming majority vote to put the communicable disease statute as it currently is in place. They're, probably the best time to put into place, some statutes is when you're not in the heat of a situation that is forcing you to examine that in a very short time frame. And so, Chapter 252, which outlines what we're talking about today, I guess I just want to remind everyone was a very deliberate, bipartisan, state level effort to assure that we were able to protect communities from disease spread. And so, we're revisiting that today, and I agree that, our legislature and our rules and orders and laws deserve review from time to time. But the intent here is very clear, and we have examples of, blatant, misuse of powers that necessarily need to drive this forward for a, maybe a what if scenario sometime in the future. These orders are used much, much more on a day-to-day basis for, individual or small events than they are for a pandemic. I mean, I, certainly hope that we don't have to respond to a pandemic, again in my lifetime, although it's certainly coming. And so, again, just, this has been debated in the past. We're redebating it now. And, I don't know that, I think looking at this from a what if scenario, as opposed to, a what is scenario, leaves us in a vulnerable position in order to, protect the community moving forward. Yeah, it's your decision. But
And one Jacob been back in his hand.
I don't think we're trying to litigate to here. I mean, that's a state statute that would have to be addressed by the legislature. I think what we're trying to do here is looking after our own backyard. I think the thing is that when the three of us were coming together about this, the one thing that we realized is that coming out of COVID, there's definitely been a damaging trust in our institutions. And what we are trying to do here is to help repair those trusts in our institutions by doing this and creating more of a check and a balance. And knowing that, I saw when, when Lebanon was being considered, there was a lot of public input and the public felt that they weren't being listened to, just frankly. And so the reason why we're here is to try to repair that so that you can do your job. And I know it may look onerous to operations, while maintaining a degree of public trust. And I understand that that's something that your department has to contend with every day. So that was the reason why I wanted to tell you about this forward.
Okay. One more. Okay.
It seems to me that, as Doug had just said, these things are rarely, these orders are rarely done. He does not issue these orders very often. I'm just wondering, what are we gonna do to the public trust when a situation in the future comes up where a disease was allowed to spread? Where's the public trust then when they look back and they say, well, why didn't the health department do their job? Why did they let this get out of hand? Again, I agree with Supervisor Defferding. We need to future proof. We don't know what might come up in the future. The way things are worded now puts a much better tool in Doug's toolbox to do what he's here to do, what the health department is here for, so that we don't have disease getting out of hand. That's what the health department exists for. And we've got years behind us that shows that we have not, as health departments, we have not abused that.
Now I'm gonna make my comments a little bit, unless you guys said something, okay? I guess I look at it a little bit different than everyone else. In the couple of years that I've been a supervisor, I respected the health department, what they do. I've been hit by so many people on the outside, on the opposite side of all this, that why don't you, first thing you get in there, get rid of the 1108? We shouldn't have it. We don't want to go through it again. There was a lot of things that the pandemic did. It wasn't the health department's problem because they were doing what someone else had told them. So I think what you're doing here is we had one heck of a 3 years of pandemic issue. So did we learn anything out of it? And if we're going to say, no, everything kind of was great, but then when they come across with a couple of resolutions that kind of just make it go back in line a little bit. Doug has already said that he hasn't really done anything that's going to really affect. So by doing this, just if somebody else is in there, and somebody else is in that office, that would be restricted. And some of the things you talk about, I know people said the fear of that somebody could have a bunch of people at his house next door and the next door neighbor could turn them in and get a fine for it. if he wanted to do that. It was all those things. So it's the fear the public had out there of what everything was. Not the health department, not, and I heard Doug, but that's not Doug, it's the health department director is what they're shooting. So when we're talking all around back and forth about what we're doing here, I don't want it to be kind of a personal thing. What we're doing is taking a look at pandemic and we're just tweaking a couple things. I don't think these things are really gonna hurt us a lot, but I think what Doug's been doing has been great. I know you didn't have a lot of research, but we could sit back here probably for a long time and throw things back and forth, why it should and why it shouldn't be. But I think we should be open-minded, because so many people out there on the other side that this shouldn't happen. I had a relative that had a hairdresser place. When ours is open and everyone else, but my place couldn't because we're too small. Or I had some friends that had churches, they couldn't have it. They didn't have any episode in there, but because it was happening in somebody on the other side of town, they were affected. So a lot of these things are fear for the people, they don't want to go through it again. So we as supervisors and people on the health board or whatever board, we have to look at what we can do to improve it. And I know I asked, the first thing I asked when everybody, why don't we just take a little bit away and get rid of it and everybody will be happy? No, we don't want to do that because the county board before us had done it. So now we're just tweaking a couple things that make sense. And I know these three have done their due diligence because I didn't want to bring it forward, but I wanted to hear what they were saying. And after I talked to WCA, our attorney, we talked back and forth for many, many days. It kind of made sense. But I don't want it to come across as like we're going after the health department and poor Doug here, okay? That's not what it's about. It's what we can do to tweak to help the public feel more secure. We know there's an epidemic of things going on that they have to take care of, but how can we restrict some of that so we don't? And county board reacted real quick and did it. And now 7 days, I think it's the other one, but that's another one talking. But they're all kind of related somehow. So my opinion, this isn't bad. This is a tweaking of what happened to learn from it. And if we don't learn from that pandemic, what do we do? You know, that's my opinion. So, any other questions?
Well, there's been a little tweaking at the state level. I think the whole piece of essential versus non-essential businesses has been addressed at the state level. You're not allowed to, consider essential versus non-essential or define that as a part of, any response. So that's something that has been addressed already at the state level.
Okay, well, thank you. Then we should vote on that, right? Because it was voted. A motion.
I move to amend 1108, section 4 as presented.
Second. All in favor?
I
Opposed?
Me.
We did two. We did two. Okay. Now I want to go into the second one. We've kind of covered a lot of that too already, kind of interweave, right? Right?
Yep.
Is there any discussion on number two? Or not number two, I should say, the D ordinance. I'm sorry.
So, sorry, it's 3-2
Right.
in favor of amending, correct?
Yes, yeah.
Okay. And the three were Harrison, Dean, and Marie.
Okay, yeah, okay.
And then Rachel
Rachel
listed
And Lewis.
Ritzmacher.
Okay. Okay, then on to D. Any discussion on that? Seeing no discussion?
Can you,
Oh, sorry.
when you get up so they can see the language
I know.
change?
Yes.
There you go. Thank you.
It's on the second ordinance they had.
Oh, I have some discussion.
Huh?
I
Yeah.
have discussion.
Oh, that's right, yes, okay. Discussion on the second, okay, the ordinance amendment.
Report said it has to be reaffirmed or revised and affirmed by the county board of supervisors. And we want to change that to at least 2/3. What was it before? What margin had to be in favor before?
What was that?
Just simple majority.
From my understanding, and this is, with Corporation Council, it was just simple
A
majority.
simple majority. That's true.
Majority of probably of those present, yes.
Then why are we going from 60 days all the way down to 7? That sounds a little drastic to me.
If I may, Mr. Chair.
Yeah.
Thank you. So, what we saw, what was, obviously the pandemic was just a really difficult time for everyone. But there was one marvelous thing that I witnessed just from standing back and watching it, is that this was a new pandemic with a new virus. And with this new virus, we actually got to see the evolution of science in real time. And it was kind of a sight to behold, because it was being massively researched by all sorts of organizations all around the United States, both federal, state, private organizations. They were doing what they can to both research, find out more about that virus, and get to know about what we can do to mitigate the spread. And the thing of it is, though, is that because of that, the thing about science is that there's no settling to it. We're still finding out more about the virus today, and we know more now than we did, 3 years ago. And so with that, we got to, things changed. The CDC has changed their minds multiple times. I mean, they changed constantly of what the CDC wanted. And so the recommendations changed. And because of that, that change can happen very quickly. It's like it can be within weeks. We're like, oh, we just found out that something like this virus. So we should maybe not do that, or maybe we should do that. And so because of that, we have to, this is something where if we're going to do a general order, now keep in mind, general orders does apply for public gatherings, no matter what, even before our the last ordinance proposal. So this applies for public gatherings. This then applies to the public at large. And again, when it comes to authority derives from consent of the governed. And we have to make sure that that the county is heading on the right path and making the right calls in regards to doing some sort of order for the public at large. And with that, we have to make sure that it matches that evolution of science in real time. And 7 days is, I think that 7 days is exactly where we need to be for that. Because if it's a new virus, there's going to be things that's going to be revealed, within days of each other, because research is just it can be done very quickly. We can find new conclusions of the virus very quickly, or bacteria very quickly. So so that's the reason why. Because if we have a maximum of 60 days, we decide to go 60 days. I mean, 60 days is a very long time. 60 days, we could, there could be some things where we change our minds. And not only that, but I mean, what do you think the public would think if we had to do another similar to what would be a safer at home order, but a county's version of it for another 60 days? I mean, we're going to see a lot of depression once again within our county. And just the idea, or just the feeling, whether that not be the intention, it just could be the feeling that they're almost incarcerated in their own home. And so with this in mind, 7 days means that we actually just revisit what we did before, check the statistics, check to see where we're at, and and that means that the county can actually provide consent for Director Guerin to continue, or not just Director Guerin, but just the public health officer, any public health officer for Winnebago County to continue as is, to extend it for another 7 days, and so forth. So that's, and to solidify that it's, consent of the governed, instead of just simply a simple majority, I find that 2/3 is totally and completely fair. Because that means 24 or more districts. That means 24 or more districts within the county are saying yes, are validating the public health director's decision to make a general order. So, I mean, like I said, if we look at what happened with the last pandemic, we saw the evolution of science in real time. So we have to make sure that our policy matches that evolution.
The county board meets once a month.
Yes, but county chair can call for a special orders meeting.
Right. Wouldn't it make more sense to, if you can't live with 60 days, that's the highest, that's the cap. It could be much less than that. And then, that's just the most it can be. if it's gonna rely on the county board's vote, why not make it 30 days then, just to bring it more in line with how often you can reasonably expect the board to meet? Because with a board our size, I can't imagine getting them all together every 7 days. I don't think that's unrealistic, totally.
It's tough, it's difficult, you're right, but in my opinion, this is just my opinion, but it's difficult by design. Because we have, if this is for the public at large, then the supervisors have to put in that work and have to put in that time. Because they are serving 178,000 people.
In a perfect world, I'm sure they would, but when you know they're gonna meet every 30 days, why are you making it so hard on yourself? Make it a 30-day then. But just makes sense to me.
Just a couple points related to this. You know, the state's already, I think, and Mary Ann, you might have to validate this, but I think the state's already changed the statutes to reflect, or the code to reflect, that you can only go 30 days and not 60. You can renew it for an additional 30 days. But I think this has already been addressed at state level. So, yeah, and so, you know, the current language is in conflict with state already. I think for me, what's most concerning is that this does not require the board to meet on a general order at all. We're essentially transferring the authority of issuing a general order, you know, from the health department to the county board supervisor, the legislative branch. So if the general order is issued and the county board supervisor, chair, excuse me, does not want to take it up, then it's just never scheduled. And so, which negates, you know, so the order could never be actually affirmed if it's never even scheduled on an agenda or a meeting is called. So I think, you know, I think there's good, there's good opinion that it's a bad idea to transfer public health authority to the legislative branch. And that's really what we're doing here. I mean, by removing any requirement for the board to see it, that's what we're doing. And the 7 days, you know, I mean, the state's already addressed that to 30. If the board's gonna meet, you're gonna be explaining what the situation is and how long you need anyway. 7 days won't ever be enough, most likely in a general order situation, to have enough information to decide how much longer it goes. Now, you can always end in the order early if it's no longer needed. But I guess I would agree that, you know, you don't even have to meet, and then you require a 2/3 of the county board membership. And you may not even be able to get 2/3 of the county board to meet, you know, at very short notice. So they would never even have a chance to be ratified by the county board. So those would be my biggest concerns related to this.
Yes, please. I'm saying, as I look at this, it says by at least 2/3 of the entire county board. This is not the majority present. Is that correct?
Correct.
So every 7 days, potentially given a 2-day notice, we're gonna have a special orders meeting. The entire county board is supposed to drop everything and come in. Is that correct?
That is correct.
Okay.
And, if I may, Mr. Chair. Notice that it also says unless otherwise authorized by the county board. So the public health director, can issue, their maximum would be 7 days. So somebody on the county board can make that authorization to extend it beyond 7 days if they so wish. And through 2/3 of, or actually through the amendment process, you can amend it beyond 7 days per what's already in the language. So, but it would have to be authorized by the county.
Any other questions?
Yeah. So the public health officer makes a general order that they can't be a public gathering because COVID-2 is out. That is advisory until the board meets. I'm asking, and I'm like trying to, okay. And then the board meets and the board says, we disagree, then that goes away. If the board says yes, then that all of a sudden becomes enforceable by law.
Mhm.
And then in 7 days, that goes away. And then 500,000 more people die because that goes away. And then Doug, or the public health director, can then make another general order to shut down a public gathering, which is advisory. I mean, like, is that how it would go? Like, every 7 days it expires and then the public health officer can put another general order out for the next 7 days, which is advisory until the board meets, and then it becomes, I'm asking.
I would say that if Doug issues the general order and there is a violation, again, I go back to the fact that there is nothing preventing Doug from issuing a specific order, okay? And then again, we have the due process because first of all, he has the enforcement mechanism under the code, and then, or he can go to court. And, the Department of Health's rights are protected, and the person who is the subject of the order has his or her rights protected as well. So I guess the question is, does this eliminate his authority to issue a directive? Because I understand general orders are advisory only, but I'm taking the position that if the general orders are advisory, it does not prevent him from issuing an individual. Of the person perhaps in the general group who might be violating or not listening to your recommendations.
Yeah, I'm not sure that's the question. I think it's clear that the health department, if needed, can issue an individual order, and that's enforceable. I think the question is that, now we've made groups of persons and locations, a general order. And if there's a need to issue a general order, then that general order there is no enforcement mechanism to that unless it's adopted by the county board. And in this situation, it's really up to the county board to decide if they even want to hear it, right? So they may not hear it at all. If they do hear it, and we can get enough people together on a short time frame to have 2/3 of the whole majority present, then it still only lasts 7 days. And if it needs to be longer than 7 days, then we have to do that whole process all over again. And, just simply not meeting. So it essentially eliminates the general order.
But it does say unless otherwise authorized by the county.
It does.
So
But
there
they
is
have to
that
meet
state.
first. And what it does, it doesn't require the board to meet.
No, and I guess you're thinking, what happens if there's an emergency which precludes the board from meeting?
Well, or just, there's an emergency that needs the general order. The county board chair could just say, you know what? I don't agree and we're not gonna meet on it. And so we won't meet at all. So it essentially, it completely transfers the authority of the legislative branch to the county board chair as to whether or not the community has a general order or not. It may not even allow the county board to hear it because the county board chair can just simply say, hey, I don't want to meet on it, or I'm going to schedule something in 30 days. And it's something that needs to be reacted to right now. So it just completely removes. And so one, we've taken an individual order and stripped it down to the individuals. And now we've pretty much said, there is no going to be no general orders, unless there's unless everyone really is, in dire straits here to support it. And so that removes the ability to, try to protect the public at any time.
Okay, we got one more for you. 1 second, okay? Again, what you're saying there is we have a 36 county board supervisors that it seems like everyone's afraid that they're not gonna do anything if something comes up. I would hope that 36 supervisors are a lot more responsible, that if an emergency came up and you came up with, and you're fine, but I would think that would be true. That if something comes up, I mean, that's how we started with this 1108, is that they had a meeting, they compromised and they made it work. So now, I can't believe 36 people, if you have some issue coming on that we have to deal with, that the chairman would say, no, I don't want anything to do with it unless he's definitely against whatever you're doing. But I would think that they would do that. The supervisors would show up because it's important to them to decide this. So we're assuming that they won't do it or acknowledge, so now we'll be stuck. You know, I know your scenario, but I can't believe that 36 people would not get out there and get this thing to bed because it's serious. And that just floors me that we think that. I just got one, he had one there first, okay.
Well,
I interrupted him, 1 second. he wanted to be, and I just threw that, okay, 1 second.
Thank you, Mr. Chairman. Just to play off of what you said, I absolutely cannot imagine in a time of crisis or emergency, a county board chair not calling a meeting. I can't imagine that. Same with the supervisors ignoring their duty or their job. I can't imagine that scenario. What this ordinance does is actually, and Mary Ann and Director Caller, to correct me if I'm using the wrong terminology, this is actually following stare decisis of the previous cases that I stated, where the Supreme Court said, you've got to bring this back to your legislative body, which in this case is the county board.
Sorry.
you know, it's all kind of conjecture. We can't imagine that people wouldn't do that, but we have an actual example. I mean, we have a county board that voted to refuse free money from the CDC just because of where it came from. Forget it, we won't take it. And that actually has happened.
Yes, it is.
So I could see them saying, we're not gonna give any more power to the health department. We're not just gonna show up. They'll take care of that.
But don't you
That's what
think-
will
I mean,
happen.
don't you think that's 36 supervisors that are representing the constituents? Obviously, that's where they came up from. I'm sorry. But
Can I ask a clarifying question? Is that
Yes,
okay?
yeah.
Okay, so as I'm trying to take this all in, if I'm understanding this correctly, the proposed changes are to future-proof Winnebago County. So our public health officer solely doesn't have the ability to make decisions. But if I'm understanding the implications of this change, we would be giving sole discretion to the county board chair. So we don't want to be in a position that we'll allow the health director to make unilateral decisions because that doesn't future-proof Winnebago County, but we're okay with an idea of a county board chair making a unilateral decision about taking it to the board and not concerned about, am I understanding kind of the implications of all of this correctly?
Who has no scientific or medical or public health training. He's the one who can make the decision. How is that?
Jacob said something right there.
Yeah, but if I may, you could extend that logic out to any agenda item for county. I mean, you could say the county board chair is wanting to hear a specific item and just won't put it on the agenda. So I think there needs to be a degree of vested trust in the policy-making body that governs this county. If you can't trust supervisors to lead, then that's a different opinion you may have. But I think the ultimate policy-making authority rests with this board. The reason why we have a deficit of public trust is because unelected officials issue orders that the public disagreed with. There is no on and off switch for society. There just is not. And so the board is going to go in a direction where they assume that a lockdown is needed. They have to reaffirm that every 7 days because there are real people, real businesses, and real families, children who have to go to school. And we're just going to say, you know what, 60 days, you have to deal with it, 30 days, you have to deal with it. No, you should be meeting every 7 days to reaffirm this very serious decision.
Karen?
And I also believe that a meeting can be called by a petition filed by a number of supervisors. So that is also a safety law, but I will need to find a specific, but I believe that is available.
Any other questions?
I would just reiterate what was said, but I think you said it earlier. putting this in the legislative's hands when they have no knowledge is scary to me. I mean, I want someone who has knowledge of health be in charge of my safety. So that's what scares me about this.
I would like to think that if the county board was called on this, that the health department would have the opportunity to come in and explain to the county board why they feel it is important that the restrictions continue. Therefore, thereby the county board then getting the information that they need to make an informed decision. Understanding that it is not a simple majority, it's got to be a 2/3 vote.
You know, if Ralph, I would love to agree that, you know, people do the right thing, right? That they're gonna meet, that they're, you know, gonna react appropriately, that they're gonna show up. I mean, we have rules in place because we have to give people guidance and we have to make them accountable. Otherwise, we wouldn't have laws to begin with, right? And so, I mean, what we're doing here is, you know, why even entertain the possibility that one person, you know, can just decide that the county board isn't gonna meet or take up an issue and force another process to occur? I mean, you know, ideally, in a case of a general order, if there is one, and this is also, you know, well outlined in terms of ordinance guidance that's been presented by, you know, Wisconsin Counties Association and others. You know, there are a number of options that we can consider in how this ordinance reads. And, you know, I guess I would, you know, I would advise you just to reconsider this. Because I think this is a recipe for trouble. It also puts an awful lot of burden, you know, on public health. You know, general orders are not specific to pandemic, and general orders aren't a lockdown, as I heard someone say. I mean, that is not what a general order is. A general order is specific to the circumstance that's needed here. And so, you know, I think that transferring that authority and not even requiring, you know, to meet based on one person's opinion, is a dangerous, you know, step to take. And I guess I would advise further discussion on, you know, on this. Ideally, if there's enough need that the health department feels like it has to issue a general order, I would recommend that the health department issue a general order and then the board meet, and if they don't agree with it, then they can rescind it. You know, that would be, you know, that would be process that allows for action to be taken and then also stopped if necessary. But it certainly would guarantee the board would meet. In this case, I mean, why do we want to put out there that the board might not even meet on it?
Thank you, Mr. Chair. And for me, you know, in this particular case for general orders, you know, first off, I mean, we have to still remember that despite the fact that 1108 did pass in 2020, it still was never issued. A general order was never issued, even during, you know, after that time, and the pandemic was still going on. So it wasn't even issued during that time. But so if a general order were to be issued at that point, it is really, really serious. It is a very serious issue. And I understand that that certainly does put a lot of burden on the public health office. But at that point, if we're getting to that point, it's going to be a burden on all of us. It's going to be a heavy burden on all of us, and on the direct fate of our lives and our jobs and how we're going to be able to provide for our families and ourselves. And if it is that serious, then we need to have a public discussion on that. And I understand that a lot of people, I understand that the argument that, you know, the dangerousness of putting this to the legislature, but keep in mind that the legislature is elected by the people. And we have to have that proper check and balance of the people, and they need to have just as much say into this as the public health officer does. And I understand, there is that, potential that, that the chair may decide not to call for a meeting. That is certainly that, there's certainly that risk. But I mean, if it is that serious of an issue, I mean, we have to keep in mind that, at the time that 1108 passed, we had a lot of people that were concerned that an unelected official could control the fate of 178,000 people. And so we are just simply giving the voters the chance to have a better say into this, because we are now controlling over the fate of 178,000 people. And I find it to be a dangerous precedent to have one person, or, you know, I would even say 36 people to have to have control over everyone's lives like that. And I don't want to get into that, that talk of like, well, if the general order isn't issued, then people will die. I think that's a very dangerous precedent to talk about here, because, you know, there is no conclusion of that some sort of strict enforcement of a general order prevented disease. I think that that's a separate argument to have. We could certainly argue that until we're blue in the face, but I don't really find that to be an actual conclusion to make. So it is very important for us to have the people get involved, and in order for the people to get involved, their supervisors have to get involved. So if it's, again, the general order is for the public at large, for the entire county. And so we need to make sure that the people have that say. That's all I'm going to say on that.
Any more discussion?
Well, I have one more thing, you know, just listening to what you're saying, I think the people do have a say, because they elect they elected John Damo. They had their say. And our health director only serves at the pleasure of Mr. Damo. So, I mean, are you gonna take every department head in this county and, you know, refuse to let them make decisions based on their expertise in their department?
Oh, if I may.
Go ahead. Sure.
Well, I mean, we don't want to get into, an apples and oranges comparison here.
I'm trying to put everybody on a level playing field and consider everyone the same.
I think that, I mean, now I served on another committee before the one that I'm currently on. And that's, the planning and zoning department. And one specific example is we had both FEMA and DNR and the city of Oshkosh wanted to implement an amendment on a floodplain map that could affect their land. A lot of the farmers' lands way out there outside of the city of Oshkosh. And I did the best I could to call and contact these farmers. And I went out to their lands and I actually took a look at their lands and I got them involved in the conversation. I was able to advocate for them. And so because of that, we were actually able to have a much better roundtable discussion on what it's like to mitigate flooding within Winnebago County. And the farmers felt that they actually had a say in it. That's one of my great pleasures of being a supervisor, serving the people. And so I think that that's where, we have to make sure that the people actually do have a say. And if it gets to the point where we have, if we had the planning and zoning administrator just simply make that decision and say, we're going to amend the floodplain map without the committee involved, that would be an abuse of power. I'd find that we would need to make some sort of changes there. But again, we had to have, it's not just simply the committee, but the entire county board has to ratify that as well.
And I appreciate your willingness to go out and educate yourself on the details of the issue. How much do you understand about how measles are transmitted? How much do you understand about how viruses act?
Well, I didn't know
Have
anything,
you-
I didn't know anything about, flooding and farming either, but I got educated pretty quickly.
Right. And how much time have you, spent educating yourself about public health related issues and how disease spreads?
If we issue a general order, I will do whatever I can.
I got it right.
But not now.
I appreciate your comment, but I think we kind of beat this pretty good now, it's okay, and we kind of know where everything is now, so. Do I hear a motion?
So moved.
I'll second. Okay. All in favor?
Aye.
Aye. All opposed?
Yay.
All right. Thanks, I know we took
Thank
a
you, Mr.
little
Chair.
while there to get all of this done, so appreciate you coming over and doing that. Everybody take a deep breath. Okay. Okay. Now, let's see here. The, looks like, we're gonna review the 2024 executive budget, right? Mark? Yeah.
Thank you, Mr. Chairman. I want to start out just by offering a few comments about the budget process in general. And then, Mr. Garing can, introduce the public health department budget, and between the two of us will.
I'm sorry, I didn't introduce you. Lois didn't know who you were.
I'm sorry, Mike Collard, Director of Administration.
Sorry. Okay.
I just wanted to talk a little bit about the process. As I said, we're here mainly to answer questions the board members may have. Obviously, it's not a matter for action by the board at this point, but to inform the county board's deliberations on the budget hearings coming up in a week and a half. So, preparing for the budget process this year, we did have some unusual challenges. One of the biggest was we had done a compensation study earlier this year and did that fairly quickly and had to make some big changes in our compensation structure. The labor market's been changing rapidly. Those of you on the county board were obviously part of those discussions. We did adopt a new compensation plan that made some fairly substantial changes to our compensation structure that affected a lot of employees and affected the county's pocketbook quite significantly. You know, the impact just of the changes made on the existing employees by the new compensation plan was in excess of $3 million per year total when you consider pay and benefits. So that's a big change that we had to find and absorb into the budget. We had set aside $2 million in the 2023 budget to address the 2023 budget impact of those changes, which turned out to be a pretty good number. It still creates a ongoing budget impact greater than that amount. So we had a lot of changes to compensation structures. As a result of that, we did feel comfortable giving departments a specific levy target as we had the previous year. The previous year, we said essentially all departments, you have to submit a base budget with no increase in tax levy usage, which we then, had to make some modifications to based on things that happened. We couldn't really do that because in many departments' cases, they would have to get more tax levy to pay for the additional employee compensation and some other factors. So we just asked each department to provide the very best, most conservative, cost-effective budget for the department that they could. Those were presented to the county executive. Each one was reviewed by the county executive and a team consisting of the executive, myself, finance director, sometimes the deputy finance director and the executive assistant sat in on those discussions as well. So that was kind of the executive team. We did produce executive budget for each department. The process was a little bit different, and I don't think it was a big difference, but there's been talk at county board about the fact that committee and board chairs weren't invited to be a part of the initial presentation of the executive. And that was more a philosophical difference in that the statutes provide, the executive prepares the executive budget, then it's the county board's turn, to consider the budget, to consider any amendments to it. So we just wanted to more carefully delineate that to avoid some confusion that had happened in certain instances in the past. The idea is, the reason I'm here is we want to not provide less involvement by the boards and committees, but provide more support to that. So we want to make sure you understand what the executive budget was based on and answer any questions you may have primarily. Again, not for a decision by the board, but just to help the county board's deliberations on the executive. It is clearly up to the board now. So we made a commitment to either myself or the county executive or the finance director has been at every committee meeting to discuss the proposed executive budget and explain the process and answer any questions. So again, that's why I'm here and we're glad to do that. I think it's very appropriate. We want to make sure you have that information. We did have countywide, some challenges to meet. As I said, the total wage package for the county is up 9.7%. And that's a lot. And it's not based on pay increases projected for 2024. It's based primarily on things we've already done. For 2024, we built the budget using a projected 2% structural increase. In other words, we're taking the pay compensation schedule, adjusting the minimums and maximums of each grade only up by 2%. So under the new compensation plan, that 2% applies to all employees, all regular employees, at least who are on the compensation schedule. And then another 2% provided for merit pay. But merit pay is now working differently than it did. Essentially, all employees who are eligible and who have an evaluation that qualifies them to get any merit pay increase will get the 2%. It's not going to be a great, a sliding scale like it have been in the past. So those are additional increases, but are well in line with what we've done in previous years. In fact, a little low, but we need to, both recognize we're already putting quite a bit more into labor and, but just the same, we have to keep up with the labor market to some degree. In 2016, the last time we did a big pay study, we changed all the grades. The next year, we didn't make any change to the schedule. We had done enough. We couldn't afford to put any more in. That may have been a mistake. It's hard to pace that once you get behind. So we want to move that schedule up every year. We want to provide people a merit raise every year. So the 2% are very, I think, conservative figures to do that. But had a few other changes. The county HR department essentially calculates the labor costs based on the positions requested by the departments. The wages are calculated on an individual employee by employee basis based on what their current pay is after the pay adjustments. And they also figure the benefit cost, which went up, I think, 6.7%. I'll say health insurance premium rates are a huge, part of the labor budget. We've been doing very well the last few years. There's been no increase in the actual premium rate since 2000. 2000 was the last time, and that was a very small increase between 2019 and 2000. So over the course of 5 years, this year we're going up 3.2%. So over the course of 5 years, we're still going up a total of 5%, which is a very remarkable record. The premiums are paid primarily by the county departments through their labor budget. The employee pays a certain portion. It's usually 12% based on several factors. If it's full-time, if it's a part-time employee, there's a much different arrangement, for instance. In terms of the overall county, first of all, we have a levy cap. We're only allowed to impose tax levy up to a certain amount. That amount changes every year based on calculations the state does to determine our net new construction for the county. The idea being if you have a growing community, you have a growing demand for services, we can increase our tax levy by that amount without affecting the average taxpayer. Have more taxpayers or taxpayers with more property-based tax on. The new construction number this year was 1.23%, which is in the range it's been. Slowly growing county in terms of new construction, but growing. And that gives us only about $740,000 more in taxes. So if you're looking back compared to the $3 million just in the compensation schedule, it's not a lot. There was some additional relief given to us by the state in the shared revenue. We get a certain amount of shared revenue the state several $1 million a year, based on the state, income and property taxes. This year, due to, state surpluses, or whatever the reasons may be, the state, did increase the amount of shared revenue given to counties and municipalities, taking it specifically from the sales tax. The amount we have, increased our shared revenue for 2024 is projected to be 1.78 million. So a little less than 1.8 million. So that's significant help in creating the budget. We also had to worry very much about, how much we're taking out of the fund balance. You know, a year ago, we do an annual look at what our unassigned general fund balance is, the unrestricted funds that are kind of in our bank account, at the board's will to spend. But, in order to remain financially strong and get good bonding rates like we did just earlier this week, you know, we have to keep a certain amount in the bank. Over the past 2 years, we've been reducing that amount because it was above our target. We're now at our target, in fact, at the low end of our target. So we can't reduce it anymore. So we have to be much more conservative about how we do that. So we tried very hard to limit the amount of assigned general fund balance we used. So it's quite a bit less than it had been in the previous budget, because it's not there anymore. We have the excess. Some amount is always unspent from the budget every year, and that falls back. So we can still work that back into the next budget. You know, if we had money that's going to remain unspent in 2023, and there will be some money unspent in the budget in 2023. There always is. It's how it works. You know, and so it's allowable to kind of roll that back in, but not to take any extra out. We also had to look at some other fund balances for specific departments, and certainly public health money was implicated by that as well, which we can talk about. And that's where we are. We did have about a $4 million in this budget use of fund balances, but mainly from other funds. Only about, I have the number right now in front of you. I think it's about $1.5 million in unassigned general fund balance, and some specific fund balances from public health fund, but also Parkview fund balance, information technology replacement fund balance is another one. We decided to change how we're dealing with that. We use some fund balance in this budget. So various changes. We do have a budget that meets the tax, a proposed executive budget that meets our levy cap. Doesn't reserve any unspent levy cap where we propose to tax at the cap level this year. We kept that $250,000 short of the cap last year just to give us a little bit of breathing room in case we can claw that back at any time in 5 years if the board decides to do that. We don't feel it's time to do that. We need to keep a little bit kind of in reserve, but not very much. And so the executive budget is essentially a balanced budget with those uses of fund balance. And obviously then I think Doug should discuss a little bit with you what department's budget looks like. Sure.
Anybody have any questions?
I have one question, because I've been so narrowly focused. What is the county's general fund balance now, and how much are we using for this budget? I know what we're doing, but I don't know what it looks like for the whole county.
Yeah, I want to say $1.5 million off the top of my head is what we're using. Sorry, more precise number. No, we used last year about $5.5 million in total fund balance. This year it's about about $4 million. Last year it was something like of the 5.5, I think it was 3.5 unassigned general fund, and this year it's much lower.
While I'm looking that up, I can just kind of run through kind of the major changes for budget for 2024. And so as Mike has mentioned, you know, a significant increase in costs for us this coming and going into next year is the increase in labor. If we were to compare 2023 labor and fringe to 2024 labor and fringe, we added a little less than $500,000 in expenses. And I'm just letting you know what that impact is countywide. You know, it's in that like 8 to 11% range, and certainly that fits for us too in public health. The levy for public health, if you look at our total levy and our total revenues or total expenditures, levy represents about 1/3 of the total budget. So, taxpayers are hopefully getting a good deal here for every dollar that's spent on levy or local tax dollars. We're bringing in $2 more in contracts, grants, or fees to support the operations of the health department. And really, and I talked to Kay about this yesterday, and think about that in terms of, primary purpose of public health, is prevention and protection. And when you put money into prevention, those dollars come back multiple fold, in the community in terms of reduced future expenses, and, other benefits to the community. So just wanted to take a moment to, let you know what a great investment the levy dollars that we have already are. The major changes to the budget itself, the big line item changes, one of course was labor. The other is grant revenue or contract revenue with the State Department of Health Services for lead abatement. Starting a little over a year ago now, I think, we launched a lead abatement program. We pooled funds that were available from HUD with the state as a part of a grant that we applied to the state with, lead safe homes funds from the state, funds from the city of Oshkosh, to create a position in the health department to really launch a lead abatement program. And Scott Fisher has been doing a wonderful job. It's been a big job to, get a contractor base identified, to create, procedure, policy, the flow for getting bids, for setting up additional lead inspections, lead risk assessments, and then, look at inspecting those jobs, submitting all those bids out, working with our accounting associate and with the finance department on getting those bids out. And that success has leveraged itself into now well over $1 million increase in funds coming from the state that we will be expending over this next year in additional lead safe homes. So that's, it's really a success for our community. The other changes, those are the most significant revenue and expense changes. Staffing changes. We are maintaining the same number of positions within the department. The net change is an increase in 1 full-time and a decrease in 1 part-time. Primarily the changes in our WIC program. And we've actually had a reduction overall, I think, in total staffing in the WIC program, but, by less than a whole position. The major new request on this is the addition of a public health deputy director position as part of reorganizing the positions that we have. And that's partially offset by the elimination of another position, within the budget. So I don't know if there's specific questions related to that. Happy to try to address those changes. Our levy for next year is in our book at $1.861 million. That is with the application of now $925,000 of the public health reserve. We have been applying public health reserve to offset levy for the last several years. That was at a level of about $800,000 during the pandemic. We received a lot of funds to respond, and we kind of pulled all hands on deck to respond. So a lot of people were reassigned from regular work to COVID work. That work was paid for by those funds that came in. And so we ended up saving levy because we put money into reserve because we were paying staff from a different funding source. We were allowed to do that. And so our current reserve fund is roughly $2.5 million. And so we'll be applying $925,000 of that. I don't know that we'll spend it all. This year we're applying $800,000. I know we'll spend a chunk of that. which will bring our levy balance down from 2.5 million to somewhere between 2 and 2.5 million, most likely. And then, we'll see how much of it we actually need to spend in the coming year. We are, you know, at this point with a lot of our pandemic work being done, we are seeing some increases in revenue for infrastructure, public health infrastructure. We're trying to spend additional dollars on additional things, persons, materials, and not as much on, essentially supplanting a levy with those funds. So.
Okay, yeah,
Just a quick question. Language. LSHP,
Yes, Lead Safe Homes Program.
thank you.
Sorry, I know, we talked yesterday that there's a lot of.
Yes, we
interference
did.
in public
And
health.
then the CUSA,
Yeah, CUSA,
That is, oh shoot. It's related to opioid, funds. It's through the BJA. It's Comprehensive Opioid and Stimulant Something Program.
okay, thank you.
Yes. I can get more information if you want it, but it's a federal grant.
Okay,
Um,
thank you. That's trying to learn the language.
Yeah, and I
I'll
appreciate
teach
that.
you knitting anytime.
Fabulous.
yeah, we almost need to attach an
Right.
acronym sheet on for our piece here. Our budget is fairly complex for the size that we are. I mean, we have over 24 funding sources. We have, state grants and contracts from multiple state agencies. We also have direct federal grants that come into the health department. So, thanks, Dave. Don't feel bad. Obviously, we can't keep them all straight. So just any general questions on the budget?
thank you. Mike, appreciate that.
Yes, I've got a question, and that is, I know that with, my husband's practice, that he would end up getting about 2,000 additional codes each year that he had to identify what he was doing. I see down here that we've got an object. How many new codes do you get each year that you've got to add into your?
When you say codes, you mean like object codes, like?
Yes, exactly.
Oh, our accounting structure, we add codes as we get new funding sources and the billing requirements change. So if we have to track our spending differently than we currently are, then we add a code. And so pretty much every time we get a new funding source, we add a new code. And
Okay,
then,
so you're in charge of that, nobody else. Or let's say the county is in charge of that.
it's up to us to report per the requirements of the funding source. And we can do that however we deem fit or if works best within our own accounting structure.
Okay,
I don't know if this is a clarification point that's necessary, but these codes are different than like provider codes for billing
Sure.
for things.
Okay.
Yes,
yeah,
this is
that
like
makes
how,
sense.
yeah, how our county finance structures, which is so different than like when I was in practice, we're billing based on all the like, I can't even
All
remember the
that-
names
all
of them.
that
Yes,
stuff.
the things. So
Thank you.
I just want to make sure you understand that difference.
We do very little medical billing. I mean, we really don't do medical billing.
Okay. And it's nice to know that basically our county is in charge of this as opposed to somebody out there.
Well,
No
The
ICD.
things that provides
Code.
with a standard chart of accounts that we have to follow.
Okay,
But we can develop it further with more detail, which of course we have, and so we, added, for instance, project codes or whatever to track particular grant or funding sources.
okay.
That do that, but that's right, in the public health, we don't really do medical billing, we do that at, human services and.
one of the requests in our labor table is to convert an accounting associate to an accountant. Just to reflect how complex, this work is in public health, and it's just getting more and more complex.
Does anything get any more simple these days? I don't think so.
We are trying, I think this is relevant, as a county, we are working on a process called priority-based budgeting. And we've gotten a certain distance. It's not really reflected in the budget book yet, except for the list of programs which we developed through that process. And what we're trying to move toward is providing much better information to the board, not just in terms of object codes and the board lines that are filling this book, but in terms of saying, here's what the expense and revenue is associated with each particular program. That's the objective, which I think is a lot more functional in terms of providing information to the board. You know, if we've got a particular program, here's our promoting healthy aging program, here's the expense associated with that program. That's not something we really have in our system currently. But our objective is to be able to show you, here's the program, here's what it does, here's what it achieves, and here's how much it costs us in tax levy and fund balance, here's how much it, produces in revenue. So I think that'll be a lot better way of looking at things that we're working toward, but we really aren't quite there yet.
Thank you.
All right, thank you. Any other questions? Thank you very much, Mike. Appreciate it. Very welcome.
So just, because we have citizen members here as well, the budget hearing for the county will be on that last Monday of October, 6 p.m. And then we'll proceed over the next 2 to 3 days. And that should be all viewable online. Department heads pretty much remain on call for those 2 or 3 days to answer any questions as the budget comes up. Typically it flows, and I don't know if there's any changes this year, Mike, but typically it flows in the order of the budget book.
There are always changes
Right.
from that based on people's schedules, but the kind of does that, starting with the administrative departments. We're asking actually the founder of that company that we use to develop this priority-based budgeting process may come and give a presentation to the board if that's allowed at the board chair as part of the executive presentation of the budget. And we are going to ask department heads to kind of focus on the program side of things rather than line by line. This one's gone up X%, that one's come down Y%. It's really focused on the programs and what the priorities are reflected in those programs and their presentation of the budget. So it may go a little bit longer than it has because we're really trying to provide more usable information for the event.
The most notable difference, I think in our document here is that we no longer, at least for me, a notable difference is that we no longer provide goals and accomplishments. What we'll do is put more effort into making sure we capture that in our annual report instead of this budget document. And then Mike, budget approvals are majority of those present.
Yes.
And so they'll be during the process of budget. There may be what we call amendments or changes that are offered up. Public health had a few last year that came up, and then we'll just try to make sure that you're aware of what those amendments are. And those are typically addressed at the end, after all the department's budgets are reviewed, then amendments are reviewed, and that, will likely be Wednesday or Thursday, probably. It's hard to say when at this point, but we'll try to keep you informed about any amendments as we become aware of them. And then hopefully be able to provide you, with some information, about those amendments, for you to process as those kind of board supervisors are voting on that, and as community members, may want to provide input on.
And to answer your questions, I defend those numbers. The usage of unassigned general fund balance proposed in this budget is $1,541,000. It's just over $1.5 million. The current, when measuring the unassigned general fund balance, the only time it's really useful to do that is based on the end of each year after all the accounting transfers have been done and so forth. So we just look at that once per year. The end of 2022 was $29 million essentially, which puts us, we're supposed to be in a range of 16 to 20% of budgeted expenses overall. And that puts us at about 18%. So it's been for the past several years above 20%. So now we're down to 18. So it's now not in the same position. So I need to be a little bit more cautious of what's used up.
And then one more general question then. What's the total budget and how much of it's levy?
So I think you're. Good question to ask that one, because, yeah, it is less than half levy, and that's why you can't just focus on the levy cap and, going up by 1% because we get greater increases each year. It's a very good question, and, top of my head, I have a number in mind, but I'm not sure it's accurate. I don't want to give you the wrong information. In terms of the overall defense budget. Sources of revenue for 2024. Tax levies about 72 million, 72.6 million out of 196 million in revenue. Do the math, it's not much more than a third, a little over a third. Then the expense budget is essentially 205.7 million total expenses. Doesn't seem to balance quite right, so I'm a little bit confused. I'm looking at the right one. Something a little wrong with that. Those numbers should only be $4.5 million. So I have a $5 million issue there that I either reading the chart wrong, but we'll figure that out.
Ballpark.
It's a ballpark.
Yeah, that's good.
All right. Okay, thank you then. I appreciate it. Doug, I was gonna ask one question here at the end. Since we kept it all over, we kept the discussion, can you postpone the second half or can you update shortly so you don't have to, I respect everybody's time. I mean, whatever we can do. I don't wanna waste anybody's time. Everybody's got hopes.
We generally agree to try to end by 10 since we're meeting every other month. That's 2.5 hours. What I can do is, and you already have copies of the income statement. I'll just tell you that as far as budget goes, we're doing fine. There's detail here if you would like to review that. And then, yes, we can, certainly save, most of the updates. I'll just give two brief updates. One, the public health vending machine grant status, that is, the county executive is holding that until the November board meeting. So, that was not on the agenda earlier this week. And we continue to, hope that, that funding is accepted and the county executive is, looking to do what he can to try to help assure that that passes if at all possible. So.
Can I ask one question on that, Bill? Because a lot of people asked that, they saw that on there, wanted to make sure. And I think I started the last time we were here, is that it was pulled, but it was pulled because you said the executive wanted to wait on it. Is that what it was?
So the first time it was pulled, it was at a meeting that both John and I couldn't make, and it was gonna be at county board.
Okay.
And then that was pulled, and then we had an article, I believe, in the Omro paper, was it? That talked about, a lack of support for, the vending machines. And we've been addressing those issues, since then, and challenges to the harm reduction program overall. And have been, trying to make sure that people have, good, accurate information, understand the programs well. And since then, the county executive has pulled it a couple of times, feeling that he felt like he needed more time, to help assure that, that there were votes to support it.
I think we should talk about it next time. We just missed on the last time we gave it, but I think there's a lot of comment, a lot of people want to talk. I know Toby had said something he wanted to discuss on that, so we can bring that up again. They're not here, but yeah.
Yeah, we'll carry it over to the next meeting, depending on when that is.
Okay.
And then the other piece is just a very, it's that time of year of a respiratory illness season. We've got a new COVID vaccine, we have a new RSV vaccine. There's obviously an updated flu vaccine. And so while we're not, we're pretty much the vaccinators of last resort for the community at this point with COVID, which is a big switch to what's happened over the past couple of years. We do have vaccine available if needed. We're really focusing our efforts on connecting the community with where they can get vaccine, promoting the uptake of vaccine, and then also targeting groups that may have more difficulty accessing vaccine. So it's not that we're not doing any work related to vaccination, but it's not actual vaccination for the most part. And the flu season's kicking off. It'll be, ever since COVID, everything is with respiratory illness seasons has been, a little bit tough to predict. Not sure what we're gonna see this year. The big game changer, truth changers are what, the updated COVID vaccine, which will hopefully help keeps hospitalizations down and severe illnesses down. And then RSV for kids, hopefully reduce the number of youth hospitalizations, infant hospitalizations primarily. And then also for seniors that are advised to take. So that's really an exciting development, and hopefully we'll do a lot of good.
All right, so we move to adjourn.
Next meeting.
Yeah, next meeting is, what's that, next meeting? Yeah.
We've got the December 21st, that's the third
Oh,
Thursday.
Okay.
The third Friday would be 15.
Oh, did I have that wrong?
Friday.
Friday is not the 21st.
15th.
Thank you.
Thanks for bringing that up.
I've got a quick question before we adjourn, and that is, why are these meetings every other month as opposed to monthly?
Good question. I mean, and I guess I just have a little more historical context. We used to meet monthly, and we just really tried to be respectful of that we haven't had a lot of voting items. And so, we've had discussion, you've had discussion as a board about whether or not it's a better use of time to meet every other month or only on the odd months if there's a voting item, and just extend the meeting a little bit longer just to be considerate of people's time.
Okay, thank you.
So, state statute requires that we meet a minimum of quarterly. We generally meet about 6 times a year right now, and additionally if necessary. So, Ralph can certainly call an additional meeting if we have something that we need to address as a voting item.
And maybe, again, just an idea, because I don't want to detain so many people waiting, if we had half of those people to one meeting, half of the next, because it seems like a lot more discussion, people want to discuss more. I mean, we love your reports and all that, but a lot, it seems like we get in discussions like, what about this, what about, and then it always seems to take longer. That's where you have to take out our time, so maybe we'll look at later on, doing it once, every month, and then you have half of what the department does, reports, and then the other half of discussion stuff. I think it's important to talk about stuff and that, so we should talk about it when everybody's here, more of us are here.
Yeah, and Ralph, if I can, one last thing. We didn't really talk about what's gonna happen with the ordinance amendments from here.
Oh.
And so the ordinance amendments, will go to county board. I don't know if there'll be any other stops along the way. I know there was an interest in having discussion and JPS committee. I assume from this point, they will proceed to the county board. And so there'll be a general discussion on this.
When I talked to them originally, they said they were going anyway, but they wanted to go through the health board first before they went to the planning board. So I said, well, we should discuss it. We should talk about it. So yeah, bring it forward. Let's do it. That's my. Oh, I'm sorry.
Just to note that, 4 of our Board of Health members are not here, did not vote.
What's that? Yes.
4
Okay.
Board of Health members were not here and did not vote.
We had a quorum though.
We had a board
No, I
meeting.
understand. I'm just letting it. Just saying that 5 out of 9 members were here and
Right. Okay. Well, we can adjourn with what we have, right? We don't have to.
Yeah, we'll just correct down here. I was counting my weeks wrong. So we'll meet
So change the date.
we'll meet on December 15,
Okay.
not 21.
Okay.
Unless there's a reason to call a meeting prior to that.
And I didn't ask for any Board of Health reports. Anybody has anything on? Do you have anything on do? Or any reports of any kind? No. Sorry, it went out of order, but we have so many different things going on. I'll make sure we try to cover it. And I appreciate your time. I feel bad that we took longer, but If we can work on that so that you don't have to stay too long. Okay, so motion to adjourn.
So moved.
Okay, that's it. I agree.
Lois second.
Thanks for helping us.
13 stakeholders.
Interesting. Sure.
Okay. This will be easy.